next speaker, Dr. Kaushambi.
Good afternoon, everyone. I'll present a paper on ocular morbidity and quality of life in patients with thyroid dysfunction. Thyroid eye disease, also known as Graves' ophthalmopathy or Graves' orbitopathy, is an autoimmune disorder affecting retrobulbar tissue characterized by inflammation of orbital and periocular fibroadipose tissues. It is the primary extrathyroidal presentation of thyroid dysfunction which frequently results in disfigurement and lowers the quality of life for those who experience it, and hence has a significant direct and indirect financial implications in healthcare systems. Our aim is to study the pattern and severity of ocular manifestations and its relationship with quality of life in thyroid dysfunction. These are our objectives. As was a cross-sectional observational study over a period of 18 months with the sample size of 77, we included all consenting adult patients attending IOPD and diagnosed with thyroid dysfunctions. We excluded the patients who refused informed consent, had history of ocular trauma, had proptosis due to any other cause, and malignant thyroid disease. The study protocol and patient assessment consisted of self-administered questionnaire which had these demographic data. The clinical assessment was based on Bartley and Godman criteria. Objective evaluation was done using VISA score, and a detailed ocular examination was done. Disease severity was evaluated through CAS score and UGOGO classification. Quality of life was assessed using Graves' ophthalmopathy quality of life questionnaire, which covered visual functioning and appearance, and we translated the questionnaire into Hindi for patient completion. These are my results. Most number of patients belong to the age group of 41 to 50 years. Male to female ratio was found around 1:1.5. Exposure to smoking was seen in 22.10% of the cases. Majority of the patients were hyperthyroid, 51.90%, which was followed by hypothyroid, 33.80%, and euthyroid, 14.30%. The mean VISA score of patients was 10.92 plus minus 4.33. Maximum patients had a CAS score of 2 and least number of subjects had a CAS score of 7. Majority, that is 59.70% of the cases had inactive disease, that is absence of soft tissue changes. Majority of the cases had mild disease, that was 55.80%, moderate to severe disease, that is 28.6%, and sight-threatening disease, that was 15.60%. Majority of the patients in this study presented with the chief complaint of staring look. Other presenting complaints were retrobulbar pain, redness of eyes, watering, diplopia, and diminution of vision. On examination, the most common finding was lid retraction, followed by proptosis, dry eyes, extraocular movement restriction, defective vision, diplopia, leg of thalamus, disc changes, defective color vision, corneal involvement, and RAPD. The mean visual acuity subset was 25.37 plus minus 31.46, and appearance subset was 23.41 plus minus 23.64. Mean total quality of life was 24.39 plus minus 21.87 with a maximum QOL value of 85 and minimum value of 0. Sight-threatening TD had very poor quality of life compared to moderate severe TD and mild TD. In present study, we found that there was a significant correlation of age with VISA score, CAS score, and total quality of life. The female patients had higher visual functioning but lower appearance scores, possibly indicating differing priorities in quality of life aspects. Younger patients had low appearance scores, suggesting vulnerability to negative emotional effects of Graves' ophthalmopathy. To summarize, there are no significant gender difference in TED in our studies, unlike Caucasian studies. Age at presentation aligns with global trends. Higher proportion of hypothyroid patients had mild disease. Severe TED was prevalent among lower socioeconomic groups. Smoking significantly worsened TED severity. Systemic diseases and family history of thyroid dysfunction influenced TED severity. Isolated lower eyelid retraction, common in Southeast Asian studies, may aid in TED diagnosis. TED substantially impacts quality of life. The clinical implications emphasize the importance of proactive ophthalmic care. The GeoQL survey comes in as a simple and valuable tool to evaluate the severity, and the grading and classification systems like VISA, UGOGO, CAS, and NoSpecs have proven to be essential tool for the better understanding and provide excellent patient care to patients suffering from the Graves' disease. Thank you.
Any questions? Any questions for the audience for the speaker? If not, I will ask you two questions. I know there are different quality of life scores and tables, right? How did you choose a GOQOL?
So basically, we wanted a quality of life which impacted male, female, and children. So GOQL has two things: one the appearance scale and visual scale. So it has 8 things in the visual scale and 8 things in the appearance scale. So based on that, the 16 criteria seemed preferable. So that is why we
Right.
selected.
And the second, two other points quickly. You mentioned 30% of patients had reduced visual acuity.
Yes, sir.
That's an alarmingly high number.
Sir,
What
because
proportion of them was neuropathy versus keratopathy?
sir, most of the patients that came were from lower socioeconomic strata. So they're not well aware that they have any kind of disease. So mostly they represented when the disease was already in the moderate form. So that
No,
is why
what is the
we
etiology of the vision loss in the 30% of patients that you had? Was it optic neuropathy or exposure keratopathy?
Sir, mostly it was exposure keratopathy because of the superior limbal keratoconjunctivitis.
Right.
And sir, in the severe cases, there was orbital compression, so optic neuropathy.
What proportion?
Pardon?
What proportion of patients of the 30% was compressive neuropathy?
Sir, hardly 8 to 9%, sir.
Okay. Hardly. 8 to 9% is 1 in 10.
Yes, sir.
Not 1 in 11. Yeah. Thank you very much.